It's a great day. If constant sinus pressure has you clogged up and breathing seems to be a hassle these days, oh, wait a minute, we live in Houston. There's a solution for you, and here to help you breathe easier, please welcome Dr. Vincent Honrubia, founder of American Sinus Institute, and his patient, Ashleigh Hoffman. Good morning.
Good morning. Thank you.
It seems for a lot of us there's a constant thing going on. I know I went in not long ago and said, my voice is gone, and it's not good for a talk show host to not have a voice, right? But there's some things we can get by over-the-counter stuff seasonally. But when should someone think, okay, this is enough?
I think whenever someone finds in any situation that they're having to continually use medicines, every week they're having to buy a Flonase or an Allegra or a Claritin over the counter, and they find that they're connected to those medicines, they should think about doing some other solution that solves the problem, not just treats the problem, but solves the problem.
All right, what's going on right now? Because it seems like everybody I run into has got watery eyes, sniffing, the whole bit. Is this just springtime in Houston?
Springtime in Houston. Pollen numbers are skyrocketing. You can go on your little app on the phone and get a pollen alert, and it lights up every day now in Houston. Grass is high, weeds high, trees high. So it's typical.
That's why I believe in silks. Anyway, Ashleigh, had you not gone to Dr. Honrubia at any given time, you might not have made it here this morning.
I might not have. I'm very allergic to the pollen, and it seems like every spring and every fall, my allergy symptoms were very bad. I'd have very bad headaches, lots of facial pain and pressure, and I finally decided to do this procedure, and it helped immediately. The next day, I felt like a normal person.
All right, so she mentioned the headaches and stuff, facial pressure, headaches, fatigue, poor sleep, nasal congestion, ear pain, snore. Basically, you are miserable. It can shut people down. So you got the procedure done. What procedure is she talking about?
We're talking about the in-office balloon sinuplasty done in the actual physician's facility without having to go to the hospital by using small balloons that go in the sinuses to make everything more open by compressing tissue without removing tissue. And the difference between
removing... Is that the way they used to do it?
They used to remove tissue to create space. Now we compress tissue to make space. And by compressing, there's no bleeding, there's no packing, very little downtime. Patients can actually go to work that day after the procedure. So it's a big difference between what we used to do 5 years ago to what we're doing now.
Yeah. All right, let's back up and talk about what happens inside here that people don't understand, which is causing that whole problem.
Which is a great question, because really people think about allergies, they think about sneezing, runny nose, but other things that happen are you get swollen inside your head, and the connections between outside space and inside your head to these big sinus cavities gets closed. And that's why people think they have migraines. Well, they probably don't have migraines. Migraines are very rare. They're probably having sinus headaches. So these issues of facial pressure and drainage and these other things that are happening are sinus related, but people don't connect that. They don't connect that. Dizziness, ear pressure, sinus related.
Yeah.
So these are things that symptoms that people have. They don't think, okay, that could be your sinus. So what we do with these balloons is go in, put them in the correct location, and make the passages open. So now the pressure in the head is equal to the pressure in space.
Yeah, and is that permanent?
Permanent, a permanent fix.
Wow, she's like smiling. She goes, yes, it is. Yeah, it's permanent. Okay, so Ashleigh, before you got to that point of coming up with that solution, what types of things were you doing just to try and keep on top of it all?
I took Allegra and Claritin pretty regularly, and I wasn't a person who suffered all year long, like I said. But during allergy seasons, the peak of them, I was miserable. So I was taking it daily. I did start relying on Afrin to try to sleep because I couldn't breathe at night when I would lay down.
It's a domino effect.
It is. And that's probably the hardest part of the whole thing, is not being able to sleep at night. And like I said, the very first night I slept, and it's just been that way ever since.
Wow. She mentioned the medications. A lot of those medications that used to be prescription only are now over the counter, and people think, well, if it used to be prescription, now it's over the counter. That's what I need to do. But as you were saying earlier, if you're getting through a couple of days is one thing, but if you're relying on it all the time, you took care of symptoms, you have not taken care of the problem.
Correct. You're taking care of treating a symptom but not fixing it. And people spend upwards of $100 a month on these medications and not even think about it. I mean, I have patients that come in that are spending on Afrin, they're spending $50, $70 a month from 10 years. I mean, that's a lot of money to be spending on something that doesn't fix it, that actually makes things worse.
Yeah.
So these are all different types of things that can be done, but the way to fix it now has become something that was more difficult to something very, very easy, minimally invasive, in the office, covered by the insurance. That is very effective.
Yeah, and it's not one size fits all. You want people to come in so you can look and see what else may be going on, because sometimes people have multiple things, right?
That's correct. So some people may have a very high allergy load, some people may have a big structural problem, Some people may have something else, acid reflux. Some people may have sleep apnea. So there's all different types of things
Some
you can have.
people are using Q-tips and putting wax in their ears.
That's correct. They come in too.
Yeah, yeah. So I want to talk about your whole practice is that you do a number of things. The sinuplasty, this is one of the things you do, but other things, allergy testings, all that type of stuff
Correct.
as well?
Correct. We can do allergy testing. We do allergy shots. We do allergy drops that you can take home. So a variety of things to treat the sinus in addition to the balloon sinuplasty.
Yeah, and Houston's a good place to do that.
Yes, it is.
Thank you very much. Thank you for joining us. To book an appointment with Dr. Vincent Honrubia, you can call 713-BALLOON, 713-BALLOON. That works out to be 713-225-5666, 713-225-5666, or log on to americansinus.com.